Good afternoon and welcome everyone to the online session on Career Path for RTs, organized on the occasion of Respiratory Care Week 2021 and also Azadi Ka Amrut Mahotsav. I welcome everyone gathered with us virtually to this online session. So Azadi Ka Amrut Mahotsav is the celebration of 75 years of India's independence, and the celebration has commenced 75 weeks prior to the celebration of the Independence Day 2022 and would extend up to the Independence Day 2023. So the University Grants Commission has encouraged all the universities and the colleges to organize various activities during the 75-week-long celebration. So the theme for this year's Respiratory Care Week is Respiratory Therapist, Resilience, Strength, and Hope. So to introduce you these three concepts, resilience basically is our ability to bounce back from adversities or difficulties. Strength, we are our strength. We all need to be leaders. We all need to be there for each other because we are working in a front line of healthcare and there are lots of adversities and problems that we may be facing. So I request you all to be there for each other. And our hope is in the vaccines and also in all the frontline workers, the healthcare workers, working in the front line and saving lots of lives. So together we are going to defeat this pandemic. So now I would like to invite our guest speaker for the session, Mr. Sriharsha Tatineni. So Mr. Harsha is the senior respiratory therapist at Al Rabah Hospital under Sheikh Khalifa Medical City, Seha, Abu Dhabi, UAE. He, as in charge of Department of Respiratory Therapy, oversees the management of mechanically ventilated patients and the clinical practices of the Respiratory Care Department. He is also Vice Chair of Seha Respiratory Therapy Consensus Committee, which is a governing committee of all the respiratory therapy departments across all public hospitals in Abu Dhabi, UAE. So he entered the field of respiratory therapy in the year 2004 at Manipal, and completing his BSc in respiratory therapy from the then Manipal College of Allied Health Sciences, Mahe, along with an ASRT degree from California College of Health Sciences, Salt Lake City, Utah, USA in 2008. Later, he went on to appear for his licensing examinations, CRT and RRT, from the National Board of Respiratory Care in 2010. He has been serving Indian Association of Respiratory Care since November 2011, and when he was working as a faculty at our very own college from the year 2009 to 2012. And he took a lead role in registering our association, the Indian Association of Respiratory Care, which was registered as ARCI back in the year in Hyderabad and changed it to what we are seeing it today as Indian Association of Respiratory Care in Manipal and in the year 2011 to 12, with legal bylaws and as a complete structural organization. Since then, Mr. Harsha is actively involved in various organizational and academic activities of the association as an executive committee member, and he is very interested in working towards the progress of respiratory therapy profession in India. He completed his PG diploma in hospital and healthcare management in the year 2012, and he is responsible for the mechanical ventilation education of respiratory care staff, nurses, advanced practitioners, as well as the physicians at his facility. Harsha has been speaking at conferences locally, nationally, and internationally, and he has always has a special interest in teaching respiratory care. So I request Mr. Sriharsha to involve the gathering.
Thank you so much, Binay. It was an honor to represent as an alumni for this gathering. Happy Respiratory Care Week 2021, and it was a great initiative to take on behalf of Respiratory Care Department on Azadi Ka Amrut Mahotsav. Being a part of it has been a privilege again. It's been a long 9 years since I had an interaction. I left Manipal University in 2012 and joined Abu Dhabi as a respiratory therapist, and then it's been a long journey, and feel honored and privileged to share some thoughts on career path for you all. Wish to interact more often. We will try to bring in more sessions. I'm sure Manipal team has been working hard behind bringing such gatherings. So before going into opening the session to you all for question and answers, just to clarify, I'm sure there are a lot of doubts. on your minds, like what's next once you finish the program, which way to go. So just try to have a brief session just to try to clear your minds as much as possible in the next 1-2 hours, how long you can stay. I'm ready, I'm free to stay here. Thank you for this opportunity. I want to thank Dean Dr. Arun Maya sir, Dr. Sabu sir, Dr. Krishna sir, and Pratibha being the head of the department, Hindu Toby as chairperson, and Binoy for organizing this as a part of Azadi Ka Amrut Mahotsav. And so first, let me wish you all a happy Respiratory Care Week. Artists are recognized all over the world, especially after this pandemic or endemic or whatever it is called now. And the care and support provided to the needy patients by artists at the bedside, risking their lives, has been acknowledged across the world. And rightly so, the hope, the strength, and the resilience that was showed by these teams to standing to each other, supporting each other, and battling this, still battling. I must say it is still going on. It's not an end. So let's salute all those frontline workers, the superheroes, or whatever tag we call them. We all like to be named as respiratory therapists, and to see you all here gathered today, it looks that future is bright for you all and for the patients, as it is said that quality care is what is required at the bedside. That's what COVID brought. The mortality is low in places where they could provide the best quality care to the patients. They did not die of COVID. Where they couldn't do it, that's where this happened. So for that, what is at the end result they realized is to provide the quality care. For that, you need respiratory therapists being there at the bedside. It's not an easy job. Especially COVID made everyone realize that, and I am sure the scope of RTs have been increased since then. A lot of people speaking for us, standing by us, shows what all we have done to the patients, and not just here, everywhere, every place, wherever we are. Okay, so that's it. So for next, I think 15-20 minutes, I'll just brief you all about what are we here for. I'll just generalize everything before we take your questions. I'm sure the questions are gonna be very different because each one have a different thought on your mind. So just wanna put something before we go into the questions. So what are we as a respiratory therapists? So we are, as all of you will agree that we are medical professionals who treat problems that are associated with lungs or breathing. These therapists work closely with doctors and specialists to diagnose, treat, and monitor respiratory conditions. The specialists I meant is like cardiologist, pulmonologist. We do have, as per the ICU, we are working, and so the specialists come into the picture there, and then we do work in pulmonary function testing labs. We do work in sleep labs. So their pulmonologists come into the picture. Their neurologists will come into the picture. Neuro ICUs, cardiologist, cardiothoracic surgeon will come into. Neurologist, neurosurgeon will come into the picture. So different specialists, doctors, and we work closely to the doctors in wherever it is and treating the patients and understanding their disease condition. As an RT, you will also have an opportunity to work with all age groups. Now that's what our profession is so different. So we start with a newborn till elderly people, and so that's a unique opportunity. Now you are being part of delivery rooms, maternity rooms, and then from there you will go in the pediatric ICUs, cardiothoracic. Newborn cases will lead into pediatric ICU there, from there, and then adult ICUs, and you saw various pneumonia COVID has created, then leading into ARDS. From there, elderly people in long-term care facilities, home care facilities. So you have multiple areas to work to choose from. Now, when you come out of a profession, you need to decide which area is your interest. So over these 4 years during your internship, you need to develop your interest and stick to that, and then grow your experience in that particular field because you like the most. The newborn care, the pediatric care, the adult care, long-term care, PFT, sleep, or you want to go into research or education, then you have masters. And so you decide where are your strengths, because from there on, there is a long road ahead in building your career. I meant every 2 years is your checking point where you got to see from last 2 years what did you achieve in your career, how strong are you in as an RT to work at the bedside. And mind you all, it's not going to be an easy task to work in these ICUs. So your confidence, your experience is what looked at and asked for. And then your strength will develop only when you like that last 2 years after you pass out of your program and how good you did it. And then there is continuous education that is required. This is not never-ending story like 4 years you finished and you're done. No, you have certification programs from American Heart Association. You have BLS, you have ACLS, Advanced Cardiac Life Support. Then you have Neonatal Respiratory Specialist, NRP. So if you're working in neonatal ICUs, that is needed. If you're working in pediatric ICUs, PALS is needed. And at some facilities who are having all these three, you need to maintain all certifications. From there, again, you have a choice to grow. And I'll talk about those and in the next slides that are coming. But I think that is what a day in our life is. I mean, you go into a hospital, you will be posted as per your monthly rota that has come out. You will be shuffled between various areas. You will treat a wide range of patients from, as I said, newborns, infants through the elderly. You will also teach patients how to use medications and equipment, consult with physicians and other healthcare staff to help develop, modify individual patient care plans. Every day in ICUs or in the wards, you will be part of rounds, the multidisciplinary rounds, and you will be putting your thought forward, and you will help the team decide which way the patient is going, what you need to do for the patient to come out of, and what the patient needs. So, and perform regular checks. You have assessments to do according to the patients that were assigned to you. You need to check everything is fine. Putting a patient on a ventilator, it definitely needs a lot of knowledge behind that, what you need to do, how you need to do it. And then when patient is on ventilator, you need a lot of assessments needs to be done. Is everything okay? Lung assessments, auscultation. Then if something is wrong, how you need to adjust the values on the screen. You need to look into those options there. And so there is when you get into your work, which is a 12-hour shift, if some facilities allow you to have a lesser time frame, it's good, but then you have enough work there on your shift, and that 12 hours needs complete complete effort from you, because anything wrong that is not assessed properly from you in your shift will lose a life, and that guilt will be there on back of your mind forever. So we as respiratory therapists has lot to do and lot to update ourselves every day according to the new modalities that are coming, new research that is happening in the field. So you getting a job somewhere doesn't end your story. It's all about how you grow from there and how you can show on that on your CV. Makes you a better RT year by year. So That's my suggestion to you all. Once you start working at bedside, have a thorough plan, develop your skills with your strengths, with which area is your more strong. Like you want a neonatal care specialist, you want to become a pediatric, you want to become an adult, or you want a long term, or you want to be an application specialist with the companies. I mean, call it according to your interests and grow your career towards it. So I'm sure you have some questions on that when I say like this, but yes, I will try to answer them as individual thing. So the next slide, yeah, sorry. So when I say that, what does an RT do in an hospital? Maybe all of you must be thinking, because different hospitals have different roles for us. So what I should say, like when you work in an hospital, you come there and then you try to work as per your posting. Now, if you're working in an ICU, you will adult ICU, you go there, you assist your patients in first 2 hours and prepare yourself for the rounds for the remaining day. What is the plan that needs to be done? Then comes, if in that case, like you have an admission coming, so you need to assess that patient, prepare accordingly what you need to do for these patients, and then ready to intubate, assess after the intubation, put on a right mode, do a blood gas, get the results, understand what is it, analyze the blood gas, then adjust the settings, assess the patient again. So each patient will take, if a new patient in a critical setup, will take 1 hour of your time. And if that patient needs further tests like a CT, if it's a trauma patient who came in, he needs a brain CT that needs to be done, then go to OR. So you need to go and drop the patient there. Then you do have other patients back. So you need to come back and continue your work. So you will face a lot of challenges. You have to assess these patients, analyze the x-rays every day. Your day starts after taking the endorsement from a night shift RT. Your day starts with analyzing the x-rays, comparing what exactly happened to the patient and what needs to be done from your side for the remaining day. That's how a typical ICU workout. If a cardiac setup, it's totally different. Cardiothoracic ICU, cardiac ICUs. It's a fast moving, there's no stagnant patients over there, but they are very critical patients. They may go into ECMOs where you need to support them during that. There are centers where ECMO training also, RTs are being part of those, where you are allowed to prime those machines. Now, ECMO is very much part of ACLS, VV ECMOs. So there are growth opportunities now. If you want to be in such a challenging field, you need to keep updating yourself, study, do new programs, and then have an ideal setup. Select one that is very famous for that, so you get enough exposure there. Learn a lot from great physicians, specialists in that area, and then from there you take it. Now, if this is not your way, you cannot handle this kind of stress and every day, then you have a lighter options. You have pulmonary function labs, you have sleep labs, where things are so easy, where you just do a, but again, you're helping these patients, asthma specialists, asthma educators, so that there is long road ahead in India. All these are coming up under the government. They are looking for starting such clinics, improving the health of people. So we need to think differently. There are scope. When you have knowledge, when you have a program degree with you, you can do all those things. So again, different thoughts will come onto your mind. I can answer all those. But this is how it is. Critical care areas, non-critical care areas, labs, and educators. This is how we can divide ourselves into. There are home cares and rehab centers coming into place now, a lot open up in India post-COVID. So we'll talk about that. So that is where you need extensive training and medical expertise. But yes, India needs these in a big time at in every level. I'm talking about not just prime cities like metros. We are talking about district level facilities where patients can come. COVID happened everywhere, not just in prime cities. So every town should have an ICU of a 10 beds. Now, if that is where it is, our scope is there everywhere. Now, start from your own town. What are your facilities nearby to your own people? Can you improve their life? If so, there you go. As an RT, there's a lot of scope just in India. You don't have to see out of India. Okay, next. Okay, now each patient, the treatment is different, and whatever you read from the books is different when it comes to the real life. And the plan, we call it, even on ventilator, it's personalized mechanical ventilation care. Each patient you have to treat differently. So they need chest physio, some may not need chest physio, some need aerosol medications. At some point, we need to know when we need to stop these medications. Inhalants and ventilators, some patients forever require ventilator support, some we need to bring them down early. So we as an artist can recommend at-home treatments, equipment. That is where educator role comes in. You have, as a pulmonary rehab specialist, you have a lot of home treatments to be planned and recommend to the patients. Artists can train patients in how to use their equipment at home properly, how to clean them. A lot of pulse ox, oxygen concentrators, a lot of things were brought during last COVID waves. Now, who will do the maintenance? How are they being looked at home? As a lot of development needs to go into that research, and we need to go at the bed at home. How many can go to each house? Who all purchased all this? So there needs to be a data that should be available, and from there we will take it. So where we all work, as I explained earlier, the first, as it said, 75% of us will work in the hospitals. And if you take Indian statistics, Indian data, where critical care hospitals and ICUs, our reach is still not been there. With the numbers being increased, a lot of you coming out as graduates, hope that will be addressed soon. With COVID, the demand has shot up, and I'm sure all of you will be placed as soon as you finish your degrees. So, as it said, you should be considered as it's a blessing that you get an opportunity to treat patients who are in the most need. One patient you save who got onto the machine, came out, that brings you immense satisfaction to continue in this profession. So we are part of rapid response teams, RRT teams, where you are responsible to protect the airways. You will help in intubating them, managing trauma patients, these are all extreme cases. There's a lot of adrenaline rush that is happening there. You perform CPR because RRT is identifying the patients that are going into arrest, hypotension, just identifying them early, desaturation. They will alert this team and you will be part of it. So you will be, as discussed earlier, you will be part of pulmonary function tests, and in hospital settings, artists also treat asthma patients and those with COPD and ARDS, and a lot of other disease conditions which you are learning during your student phase. And in the ICUs, you have neonatal to pediatric to adult ICUs, you have emergency rooms, you have trauma rooms, and so there are a lot of departments in the wards who are using non-invasive ventilations, high flows, which have come in during the COVID. So everyday assessments are required. So that's a larger picture what artists does in the hospitals. We'll go next. If not hospitals, where can you? Yeah, sorry there. If not hospitals, where can you work? In home care facilities. Um, India has started these facilities for the last 2, 3 years. A lot of them have come up. They were there, but very rare before that. But now I keep hearing a lot of them are available. So in this place, it's one-to-one patient at their home. They have been loved by many of them. They have the facilities, everything arranged. It's a challenge. Working in hospital environment, you have everyone available, the doctors, the nurses, the team, and something happens, you just rush in and you get help. You just press a button, code button in the patient room, you get help. At home care, this doesn't happen actually, as only one nurse, maybe a caregiver that's being there for so many years. If something happens, from there, it's you need it's a real challenge there to address these home care patients, and you need to be top of your game as RT if you're working in home care. Ideally, it is considered in Western countries an equal job, not a lesser job. If that's how the mindset is, it needs to be changed. As I explained, at hospital, you get a lot of help. At home care, you don't, but you need to handle these patients. You get to change the tracheostomy tubes if they are there for long. You need to manage the troubleshoot a ventilator from somewhere. You're not next to the patient, but you need to understand it and treat it. So keeping everything in control at the bedside is what your challenge, and that needs a very real specialist to be there. And artist's role comes in to manage these patients with um, home NIVs, home mechanical ventilators, maybe only on trachs, but that needs to be maintained. They should not be getting infected. So a lot of work again there. Rehabilitation centers, they are being developed now. They a lot of them again have been there now in metros. They need to go down to much towns and bigger cities also all over the India. So you need to be trained for next 2, 3 years if that's your area. You think develop your skills and then start your own rehabilitation centers, or you can be part of a very good ones that are being developed. So in this, you got to plan how to improve their muscle strength, muscle power, and making them independent, walk on their own, even though they have some disease conditions that may need some support. But you need to streamline, wean off some amount of oxygen so they can do their activities. They should feel better about themselves. And that is what the role is all about. You will work along with physical therapists, occupational therapists, sleep therapists. It's a combined role in rehab centers. Sleep centers, sleep disorders, breathing, for last over 2 decades, a lot of patients have been diagnosed with these problems, and artists does these sleep studies. They do sleep titration studies, sleep disorder breathing studies, and then identifies a patient who requires an NIV CPAP machine according to the pressure we will set, and then relieve the sleep apnea. So overall, their life gets better. They get good sleep in the night and less pressure on their heart, less load. So that role is there, but you should be ready for those night shifts all throughout your career. If that's okay for you guys, this is your role. Also, you have application specialists who have been there for the companies. Then if you are very smart at reaching out to the people, selling a product, this is your area. And if you are a respiratory therapist, companies prefer you. If it is a ventilator company or a company that is dealing with a respiratory care equipments, you are the first choice for them. But then from if you chose this specialty, then coming back to clinical bedside will be a challenge because you never develop those skills of working at the bedside. You will not be looked at. But if you want to grow as in that field, if you are smart in those things, you will reach at very high levels of selling these products. So maybe you're not at bedside, but this is a different role. So there are options. Okay, there are streams which you want, but again, it's your call, your choice, and your situation at that point of time. So if that's you, and you're a good seller, and that is what it is. Is this video playing?
Has been defined as the healthcare Respiratory care has been defined as the healthcare discipline that specializes in the promotion of optimal cardiopulmonary function in health. Respiratory therapists, or also called RTs, apply scientific principles to prevent, identify, and treat acute or chronic dysfunction of the cardiopulmonary system. Respiratory care includes the assessment, treatment, management, control, diagnostic evaluation, education, and care of patients with deficiencies and abnormalities of the cardiopulmonary system. Basically, what I'm trying to say is respiratory therapists help treat patients with diseases of the heart and lungs. Respiratory care is increasingly involved in the prevention of respiratory disease, the management of patients with chronic respiratory disease, and the promotion of health and wellness. Respiratory therapists, or also known as respiratory care practitioners, are healthcare professionals who are educated and trained to provide respiratory care to patients. Approximately 75% of all respiratory therapists work in hospitals or other acute care settings. However, many respiratory therapists are employed in clinics, physicians' offices, skilled nursing facilities, cardiopulmonary diagnostic laboratories, and public schools, while others work in research, disease management programs, and home care. Also, some respiratory therapists are employed by colleges and universities to teach students the skills they need to become respiratory therapists. Regardless of the practice setting, all direct patient care services provided by respiratory therapists must be done under the direction of a qualified physician. These physicians are usually specialists in pulmonary medicine, anesthesiology, and/or critical care medicine. So what is the job outlook for respiratory therapy? A survey conducted in 2014 by
Okay, that is to summarize what we discussed so far. I found that video to be really precise, explaining everything. Very important point. We work in conjunction with the physicians. Whatever field you chose, we need their orders, we need their approvals, and the plan we design. We are allowed a free hand, but we need to go through them, explain them what we think, get their approvals. If you are an adult ICU, there's a critical care physician. If it's an neonatal ICU, neonatal specialist, pediatric ICU. So whatever area you chose, we should get that right physician and their approvals, and the plan needs to go through them before you decide what you're doing for this patient. Keep that in the back of your mind. Even if you're trying to open your own lab, you need a physician to send to your patient, sign it off your records, whatever you're doing, PFT or sleep. Now, very important to understand what is required as an RT, what skills and traits for pursuing once you're already into this career. As I explained earlier, we work in ICUs, ERs, and these areas and require an excellent communication skills. You are working along with a nurse and a physician, and we need to go on the same level, whatever you are doing. So if you don't communicate it, say, this is my work, let me do it my way, it doesn't work out that way. Communication is a key. And over these years in your degree, you need to develop it. The more you spend time at the bedside, you get this skill better, the communication with the patients and their families effectively, but at the same time with the doctors and the nurses at the bedside and during the rounds. Now, putting your point during the rounds is not always easy. It's not that whatever you say, the other person has to agree to it. He must be having his own version. But that is where being top of the knowledge is important, because when you say something medically, if you want your point to win, they should understand you have read about it, know about it in detail, because when he fires back a question to you, you should be able to answer it for him to say, okay, he knows something, what he's saying is right. So that's what I said. Getting a job is not end of a story. Developing your experience and the knowledge over the years is what is important, and it should be a ladder. You should keep on progressing on that. Compassion and patience are a must. Patience in our profession in handling difficult and emotional situations. Patients and their loved ones need comfort and reassurance during diagnosis, treatment, and beyond. Now, how you react to this at the bedside also is very important, because we are facing lot of these deaths and very critical situations. So family come in and they are in an emotional situation. So how they react to you, you should able to take that, soak in that pressure, and talk to them with a smiley face. At some point, understand their pain, and you have to show that patience. So despite how uh, situation is there. Now you cannot show your anger or frustration at any point when during any point of your shift, even though how busy is your shift. It would be best if you work well in high stressed, fast paced situations. Now, if you decide that you want to be a respiratory therapist working in ICUs, you got to build your career in that direction. Choose the hospitals that are famous and that gives you enough experience in such high stress and fast-paced situations. The more, and India is the best place for that. Trust me, guys. So you got to have enough experience in India before you start looking. When you lack those experience, that is where you find the situations out of the country difficult. India gives you experience in every kind of cases, but it's up to you to work in a good facility after you finish your degree and get that experience. And being detailed oriented and organized are also important in pursuing a job career. It's not just you finish your degree and start searching for jobs abroad. No, that doesn't help you either. A 2 3 years of experience back in India in a very good facility will open these opportunities for you. So keep that in the back of your mind that you should not start searching right away, but it's important to develop your skills back in India there, and then from there start applying. So you have a time frame. Plan the time frame accordingly. Once it is done, you are confident on your skills. That's your time to search for abroad. Now, when you go out, I also want you to remember there's a lot of quality things that come into picture. Everything is electronic documentation. It's coming up in India also, I'm sure. But so these electronic records can be opened at any point of time. So whatever you do to a patient needs to be recorded, and that can be opened at any point of time. So you are completely responsible for the acts you are doing. So that's the reason why I'm saying, for your safety and for the patient safety, your knowledge and how you handle these high stress situations is important. So that experience of you will be handy in such situations. Career ladder. Now, every career needs to have a growth, and you need to have a checkpoint every 2 years to see what you are doing. Where are you? What did you do in these 2 years? And what is your next 2 years to be planned? And this is how I did it. This is what I recommend you all to do. And for that, you need to update yourself. It's not just working in a hospital, not updating yourself, not doing new courses doesn't help. According to your interest, do some every time, learn something new and build up on your CV. So when you send a CV across, that should look unique from others. And only that happens only when you have your 2 year checkpoints and follow them. So what do you need to get there? So again, I explained you everything. So you're in a better position for landing in your dream job. So you maintain your 2 year checkpoints, you update yourself, you're constantly learning new things, trying to publish something, articles or wherever area you're working, that strengthens your CV. You have a bachelor degree now. There are competency assessments that will be done wherever you go in a new place. So that is what I said. Now, if your facility allows you having an experience in all three areas, neonatal, pediatric, and adult, get all three. Try to rotate every 2 3 months or something and ask for a different approach. So you will have an idea on all areas. No, you are a person who wants to stick to one particular thing like a neonatal care, then grow your career in that direction. Work in a very best neonatal hospitals so that you can apply for a neonatal facilities abroad. Who prefers to take you only into neonatal hospital? So it's all important. What is your like and dislikes, and what are your strengths and weaknesses, and from there grow your career. It's all in your hands to decide on that. From there we can help you in which way you're going, but first call is yours. Okay, I don't know if this will play. This is the video we developed for my team after the first wave of COVID. So it's a brief tribute to all respiratory therapists. And I hope it will play. Okay, yeah. So as my team was, according to the situations, we were being asked to treat patients in 3 different hospitals, then 5 to 6 various ventilators, different ABG machines, and all this was happened when no time has been given to plan, because it is a sudden surge and all, but we were ready as per the need, and we were moved to various hospitals. We work, various help different patients, and this is what it is. When you are a skilled RT, you will be thrown at challenges that you should be ready to take up, and then you will be given due respect. So it's a great example, and the words that are used by ARC for this year's theme as hope, strength, and resilience perfectly matches. So for the last 2 years that every artist across the globe has gone through taking care of patients, and I respect all of them for what they have done. And that's it from my presentation. So we are open to questions on what you have seen so far. Thank you.
Well, thank you, sir. Thank you for showing that very encouraging and inspiring video of RTs and other healthcare professionals working in the front line. And to all the students of respiratory therapy in both Manipal and Mangalore campuses, may I just remind you that many of the faces that you've seen on the video are our very own alumni. So it's a proud moment for all of us working and studying and who are a part of MAHE, that this video showcases a lot of our very own people. So like I have previously mentioned, we've shared an online form to collect a lot of your questions and your queries that you've been wanting to clarify with some expert. And so we have an expert here with us today. I will be sharing the questions with sir, and sir will be trying to answer all those questions as best as he can. So, sir, shall we go ahead with the questions?
Yes. Yeah.
Right. So the first question was by Hridya and Annie Matthew, who's a first-year UG student. But the question was on job prospects and higher education, but I'm sure your presentation has covered almost everything in that aspect. So moving on to the next question, we have Anne Mary from first year UG, who is asking, I enjoy working with people directly. So is pulmonary rehabilitation a good field to consider working in once I've finished my studies? Or should I rather work in hospitals for a while and then maybe try rehabilitation work? And are rehabilitation centers available everywhere in India, or is it scarce?
Hi, Anne. It was a great question, first of all. My suggestion to you, first work in a hospitals in an ICU, understand how the patients go through from ICU to the wards. So you will understand the needs and what are they lacking and how they can improve on their strength. And 1-2 years of that will help you have a better understanding. And then 2 years on a pulmonary rehab facility, so that you can build on that knowledge, what you have already worked. So you have a complete picture what patients go through in an ICU. And from there, you can take it from your existing experience. So that's my suggestion. So hope that such kind of situation be available for you once you pass out. So it's always important to have a complete picture, and that comes only when you work in a hospital. And so have an initial hospital experience, then develop your rehab experience, then you can go and work. During this time, you may change your mind also. You may start liking working in hospitals. We don't know. So yeah, that's my suggestion.
Right. So the next question is from Lakshita Shetty, who is a first-year undergraduate student. So she asks, can we pursue our master's in RT along with working as a respiratory therapist?
Lakshita, yes, I mean, so for me, I will tell master's is a totally different stream now. If that is an opportunity that is available in some of the colleges in India, it's fine. But then are you looking at master's as a professional growth of your career, or you want to streamline into educating students and develop into research? You know, we need to start going into those fields. There's a lot of research that is required, and if you're doing a master's, I'm sure you're academically more interested. So you need to be on, helping students in various colleges. So you need to do a proper degree if that's the case. So you develop your knowledge and skill, and then go in that direction. But then, if you want to be bedside and then grow in the profession, go into the field, work for a few years, then see what are your interests. Now, from there, if there are some universities offering you and that can be done online and that helps you in growing, maybe that's the option. But then if you want to work completely as an MSc graduate in a different research or an education field, I will suggest you do a proper master's, not a distance master's. So that's two different ways of taking it. But once you work clinically, there are other things, not just masters in respiratory, that help you grow in your profession. There is infectious disease specialist, there is quality specialist now, which you can develop by doing these programs and then grow in your profession, or some hospital management programs if you're more interested in that direction. That also will help. So that happens only when you start working clinically. You will understand which way you can grow, then that way. But then from beginning you are academic oriented, then do proper masters, then go in there. That's my.
All right, perfect, sir. So we have another question from Mr. Rohit B, who is a second year BSc student, who is asking how do we apply for TMC and RRT exams? So it's a very interesting question, and what is your take on it?
Rohit, thank you for that. I think that was $1 million question. A lot of them have it. So, as of now, unfortunately, that option is not there for anyone who is passing out of RT degrees from India. We are 35 artists from Manipal who are fortunate to do this program back in 2005 to 2008, which was offered by Independence University from California, and we could clear that credentials of ASRT with X remaining points. So what happens now in these programs is, so if you open NBRC says you should have a COARC accredited degree. Committee of Accreditation for Respiratory Care is what is identifying these colleges. And they recognize these colleges as a quality, who are offering a quality degree in US, basically. They're there in some other Middle Eastern countries like Qatar and Saudi. Then once you finish, then you need to apply for CRT license board exams and RRT license board exams, and you will be eligible, you will be given those credentials. Now, we tried to, after this 2005, America has stopped distance programs out of US, and you will not have eligibility. That's the reason the program is scrapped. We did had a try in 2010-11 to bring this COARC accreditation to Manipal, but it was costing a lot of money those days, and we don't have that many students back then to support that cost. But that's the reason why we did not go forward with the program. So basically, you need a COARC accreditation college or a university for your respiratory program to appear for these license board exams. Right now in India, none of the colleges have it. Now, what you want to get them, do you need to get them? Ideally, no, for anywhere to work other than in US. I have an RRT, but since 2010 I have it, but I could never go to US. So it's not a straightforward thing that you get an RRT and they'll take you for a job. It's not like that. You have to have a US visa, valid visa. Like you should be a citizen of America, or your family is there, they are citizens and they can sponsor you. Then you are a candidate to look for RRT and go there and work. Otherwise, it's not needed. Bachelor's. I am sure over the next few years, we will work on developing various things with the government of India coming into Allied Health Council, and we will look into developing and strengthening those things in India, certifications. But then this is my answer to you. I have RRT and I couldn't go to US or Canada or anywhere. So whoever went also could not work. They're working on with some other spouse support once they get their visas. But without that, you can work in Middle East, you can work in Singapore, you can work in other places, other countries. But the requirements vary in different countries. We will look into that picture, like Australia and UK needs as respiratory scientists that have a different exam. It's more about pre-FT and sleep. So you need to read a lot about those. And if you're well versed in that knowledge, you can give those exams and respiratory scientist and start working in UK. hopefully, European Respiratory Society is working on programs in respiratory therapies into critical care. So it's still in the discussion phase. Nothing has happened, but maybe it will change. But right now, at critical care level, we are not working in UK and Australia, New Zealand. We're working as scientists in PFT labs. So that's my answer. It's a little difficult to understand this at this point, but I suggest it's not needed for any of this right now. It's fine. We can be a good therapist without those.
Right, sir. So the next question, in fact, there are 3 questions from a user, from a second-year undergraduate student by name of Achintya Rajesh Shetty, who would like to ask the first question. I'm skipping in the interest of time because we have already covered it. The second question, are there any specialized courses on spirometry and PFT? And the second part of the question is, any entrance exams to answer for jobs in the US and Middle East?
So yes. I got it. Got it, Vinay. So PFT and sleep also?
Yes, in fact, you just mentioned some spirometry and PFT, which technically
spirometry and PFT. Yeah, okay, yes. Now there are PFT for again NBRC has a certification board, but then again you need to have a CRT, RRT to write them. But for New Zealand board, I think you can, for respiratory specialist, scientist exams that you are eligible to get that, but you need to have a very thorough knowledge on spirometry for that. Once you have it, you really read those. The books are available, but some eligibility exams we are not. Like NBRC boards are not allowed, but I think New Zealand will allow you to get this respiratory. If your interest is into spirometry, grow in that and study in detail about PFTs, work for a couple of years, then start preparing for this respiratory scientist exam. And then you can appear for them and then go into those fields. There are a couple of exams on that. And you can work independently in these labs under pulmonologist, and so those are my options. But NBRC, you are not eligible to do it, but New Zealand boards, you are.
Yes, sir. But in the meanwhile, what are our options available in India? Are there any specialized courses on spirometry, PFT in India?
India should have good centers. CMC is one of the best centers. Way back since I am a student, I've been there. They have body box. They have everything, nitric dilution techniques and everything. I am sure there are multiple centers coming up, and government looking into improvising all these things. There should be a real center with all these facilities. You should be able to do one person coming into. You should have all at your center. And handheld devices have come into now with artificial intelligence and everything. You can do everything with an iPhone, with this very small device at bedside, and they are very accurate too. So, and develop this data and send to a physician to approve it and then release it. You can just go and open a clinic anywhere. And once you are a professional in this field and you have a license, which is Allied Health Council is going to do it, and you can do all this. Once you develop your skills and knowledge, we're working on various missions, how to read it, and then you can start your own clinic. So find out a center in India that is advanced in these PFTs and then work there. Where it should have everything. It should have helium dilution and body box and a basic PFT. From there, you know what you need at any level, and then connect the dots. So the best physician over nearby area, and then go there, choose a factory, do for all of them, and publish the data. So you will be in need actually.
Right.
So there's a lot of scope there, potential there, but it's not being exposed or tried out. That needs to be done actually. That's a good question there, and I think by next few years we will channel the growth in those fields also. That is.
So the same person has asked a third question, which was about entrance exams to answer for jobs in the US and Middle East. I think you have already answered about the US. So can we shed some light on the Middle East?
Middle East, yes, Saudi, Qatar, Kuwait, and UAE. So UAE, I will talk about UAE because I'm at UAE right now. Then you need to have minimum 2 years to 3 years of experience post your degree. Last 1 year was an exception due to the COVID waves. A lot of them have been taken in temporary positions without these licenses. But there is a licensing body, there is a licensing examination because there is a license that will be issued once you clear this exam. So we are all eligible to sit for these exams in all these Middle Eastern countries. I'm not sure Kuwait at what level is the exam, but Qatar has, Saudi has, and UAE. UAE had it for long right now. And once you clear the exam with your experience, you will go through a data flow verification process before you are issued this exam approval. That will take 6 months to 1 year, depending on your documentation submission. They will have a verification on your degree, on your experience, wherever you worked. Once it becomes positive, they'll open a file and in the licensing authority. Then they will allow you to sit for the exam. And once you clear it, the license will be issued against a facility that is ready to take you. So if you don't have a facility that is ready to take you, you don't get a job, you still can do the exam, but your license will be kept empty for in a year. Within a year, you should able to get some hospital that can take you so that your license is linked to them. Now, this is how it works, basically. So in UAE, you have 3 different licensing bodies: DOH, Department of Health in Abu Dhabi; DHA, Department of Health Authority in Dubai; and MOH, Ministry of Health in Sharjah. So 3 different licensing bodies and 3 different processes for them. But mostly all of them, DOH is supposed to be the top Abu Dhabi one, which has more verification process. Next is DHA, next is MOH. And so once you have 2 years, start this process. Within 3 years, you should able to, if there are enough openings, you should able to get these jobs. The same stands for, I'm not sure about what is, I think it is similar 2 years for any other country also, 2 to 3 years. So my point, gain this 2 to 3 years in a very good facility with a good name, which is very busy and handling different cases in ICU, so that you get a good experience. And from there, you should be able to answer the interviews well, write the exams. It's all your clinical knowledge that will help you in clear the exams. And then you are able to go and get the job. Yeah, I hope I'm clear in explaining this. And any more, you can just write to me anytime. I will answer that.
Right. So next, we have a question from Prajna NS, who's a second-year student, undergraduate student. So she asks, after finishing our BSc, can we get job or we have to do higher studies? Yes, I think we have already touched upon that. But if yes, what should be done for that, and what all are the job opportunities? So I think we have covered most of these. So do you have to, would you like to make any other comments on this?
Yeah, quickly, I suggest, as I explained earlier, first look for gaining the experience right after that. It's not appropriate to go somewhere without having a clinical experience, because our RT role is in allied profession is totally different from others. Working in ICUs needs a lot of bedside experience. We need to soak in a lot of things, soak in the pressure. And when you come to these places in abroad, what they'll assess you is they're all artists who are working for so many years. They'll expect the same level of skills from you. For you to match to their level, you should have a strong experience back there. Otherwise, they'll say, okay, this person doesn't know anything. Because all these places, when you go to a new place, has 3 months of probation period. They don't just give you job straight away, even though you went through license, you got everything. But still, they will test you at the bedside clinically that you're strong enough, you know a lot of things, you can handle the pressure and all. That only comes with experience. So, and choose a big hospital which is handling these cases when you're working. Try to develop your skills as a team, work in a facility where more people are there, rotate among ICUs if your hospital has various ICUs so that you get different skills. Some hospitals have all the varieties, all different ICUs. So they expect you to have everything, knowledge. Some of them will limit you to very one area. So I prefer a candidate who has knowledge in every area, right? If you can get that, that's the best. But if you get only, if your interest is only into pediatric or only to neonatal, develop only in that direction. There are hospitals only to take only into those areas also. So it's again your call, your choice as a candidate.
Right. So another student from UG third year, Ashwita Shanbag, asks about something of the similar line. She wants to know about the career options, I think which you have already discussed in your slides, and also how to apply for jobs abroad, which also probably, Ashwita, you would have got the answers by now. So we move on to the next question, which is from Mr. Vignesh Prabhu, who's a UG first year student, who asks how to get a seat in MCHP Mahe Manipal for MSc in Respiratory Therapy and what are the requirements and criteria for selection. So if you don't mind, I think I will answer the question quickly.
Yes, you're right.
So Vignesh, you first need to have a valid BSc degree in Respiratory Therapy from any of the institutions, which you're currently undergoing. Congratulations to you. So what you need to do next is to apply after you complete your internship for the seats, and once your applications are filled in, they will be calling you for an interview, a personal interview. So you'll have to clear the interview and you will be shortlisted for the seats in for your master's in respiratory therapy according to what specialization you require. So of course, depending on the number of seats that are available for the course at that particular point of time. So the next question is from a postgraduate of ours, Mr. Vineet, who asks what are the job opportunities and scope in the UK and what are the requirements?
Yeah. No, who's that? Vineet.
Yes, sir, Vineet.
Hi, Vineet. Yeah, in UK, as I explained, our role is like more into PFT and sleep labs. There's no critic bedside RTs working in ICUs there. There's nothing licensed for that. But if you have an respiratory scientist license from New Zealand or anywhere, you will get easily the jobs. But then you should be into PFT and sleep labs. That's the only thing right now. They are working on the program. There's no respiratory care program as such yet. There's nurses handle ICU patients on ventilator in UK, and but they are trying to bring in our profession, but it will take a while, maybe 4 or 5 years from now on to have. There are very few of them working at bedside, maybe hardly one or two, but they couldn't. I mean, no official process to go. If you can go there somehow with your family help or you have a valid visa somehow, and then you show your experience and hospital likes you to take you. But that is a different story, but that's a different channel for every one of us. We cannot do that. So if you are valid RT with a license degree and work experience, they should able to hire you. That process is not there in UK as an RT. They'll hire you if you have a respiratory scientist and working in a PFT and sleep to develop into I don't know what they are developing, research for masters, and there are programs that are coming up in masters in critical care and ICU management. So once that happens and we are established there, then maybe they'll open the jobs.
Okay, so next we have a question from one of our intern who asks about something very Karnataka specific. Can we get a good job opportunity in Karnataka and with a good satisfactory salary for BSc respiratory therapists? I think, yeah, if you can comment on this. If not, I can add on that.
I think Karnataka had a lot of colleges right now in the last 5-6 years, I believe, and Bangalore, Mysore. The job market is kind of, a lot of them are available in the pool, but I'm sure there are jobs about appropriate salary, being Allied Health Council being formed. And I was told there are central government job scales and jobs being offered in these hospitals after this our profession has been mentioned in it. And I'm sure the minimum payment should be equalized to those that was decided by the government. And AIMS Rishikesh having the program, so they should hire their own RTs in that hospitals. In all AIMS, there are a lot of AIMS hospitals that are planned across India. If it is, I'm sure AIMS Delhi also is looking to recruit. So if maybe in this year we will have a clear picture on what are the pay scales, and I'm sure the basic pay scale is gonna increase according to the central government. Till now, the problem why it is on the lower side is because we never had a government positions. With that coming into the picture and with the demand going up for our scopes, I think you should able to get a good salary. Again, in the first 2 years, I know we are all eligible to get a higher salaries. We, from IRC side, we are working to push that on to change that as much as possible. But yes, it's a challenge initially because in India they try to recruit you for very less amounts. Once it is established in every hospital, my suggestion to you all who are passing out, go to a hospital where it's not established, which is busy. Show your potential, what you know, how much you can work to them in ICUs, your knowledge. It's all about how you communicate back to them, show everything what you know. They like you, they should be able to recruit more under you. This is how I started. When I started as an RT in India, there was no artists there. They were there, but they were being paid very less. But then when I started with a high thing. But then I spoke to them constantly to the management that we need more artists. And when I go, they should be able to take 2, 3 more. Or when you are there itself, they should consider taking 2, 3 more. That's my point to all of you. Go in an area where no one has tried it, succeed yourself, then you are laying a path for the new people who are coming back. So that's what I did when I was in India. That's what I did when I came to UAE. I could recruit more from my alumni staff or others who are passed out from India. So that's how all of us should do. If you settle down, prove yourself, take 2, 3 more. And that's my humble request to all of you. And I hope all of you could get into good jobs right after you finish. We are looking at a lot of changes in healthcare in India. So we are having a different scope. So the thing is, we need to go in different fields, not just stick on to one. As I said, there is like CIC certification for RTs, like infection prevention program, certificate of infection control. If you like this, because now the future, they say 5 years is all infectious diseases. After 4, 5 years of working in ICUs, you develop this CIC certification online and study for it. It's a little about microbiology in depth, but then it's not that you cannot pass it. Then you're eligible to do as an IDRT in your hospital, taking, that's a bigger role, management role, looking at the standards of infection in ICUs, wards. We are close to that role. Then quality, there are 2, 3 certifications in quality management. And so there are a lot of quality things, like it's not running a department is easy. Running a department needs a lot of planning, a lot of developing a quality. Like, you run a blood gas, I said there is electronic documentation. I tell you 2 examples. And when we identify the patient wrongly, like because we have to scan the patient ID, run the blood gas, send it to the patient ID on the system. What happens when you take a wrong sticker, scan it, send the wrong blood result to your patient file, which is not supposed to be that patient. And that's a patient identification error, which is a quality derivative thing. So as a department, we have to develop a plan to decrease such incidents and work on it. This is one. There is other one where we set patients on ventilators and we don't change alarms. So important when you set a ventilator setting, you also set alarms, right? According to each patient. Each patient settings are different. So again, we developed a quality initiative project who are not changing the alarms. So developing a quality certification is also important. So there are different fields, different streams to this section. So for me, I hope you will get a job in Karnataka. It's all about selecting the right hospital and the market around there, how many are available. If not, go to other kind of states. It's not that you cannot survive in those, because if you are trying to come to abroad, you should able to handle different cultures. You start seeing different people. So only that with India you can give you and go to south, go to north, go to east. You have a lot of options. Maybe you will be identified uniquely in a different place, not in your own state.
So the next question is from first year undergraduate Unnati. So she asks what kind of a job should she probably select, whether she should go for a teaching job or for clinical work in the hospital. So, and she also would like to know what is the difference.
So which year she is?
The first year, sir.
Depends on your interest, Unnati, and it's a long way to go. Finish your internship and decide on, are you want a teaching profession to continue as or a clinical. It will change, I'm sure, next 3 years. A lot will change, a lot of things will happen around, and you may like it. First thing, you all have to like your own profession. Once you took this, you should be confident when you pass out as interns, as artists, that you can handle anything. If you are not confident, then develop that confidence in wherever you're working and prepare yourself. So, as I said, communication and knowledge, updating yourself is important in our profession. From there, you can decide on, if you cannot decide after internship, you always take up a job and take your time on that. But if you have decided already your mind that you are for teaching, academics or your thing, then take up the master's. So that's your call. I won't force any of you do this, do this. So I'm here to guide you in general. From here, you should able to ask me if you, what is your doubts in specific, and then I can answer that. But for this question, I'll say take your time. Wait for 2-3 years, and you will have a better understanding.
Right, sir. So the next question is from Ms. Agnel Joseph, Mr. Agnel Joseph, who asks what is the role of a respiratory therapist as a production manager. Maybe you can answer about the role as a respiratory therapist, as a respiratory manager.
It is in the companies he meant, or as a clinical setup? What is he?
Agnel, if you would like to unmute and ask the question directly.
Sure. Let him go do it. Yeah. Is he there?
So in the meantime, I think we will take the next question, which is from Mr. Mohan Prakash, who is a postgraduate here, who asks what are the job opportunities for postgraduates in foreign countries? What are the requirements, qualifications needed to get into assistant professor or senior respiratory therapist post in foreign countries? He is asking specific to the UAE.
Okay, what's his name?
Mohan.
Hi, Mohan. Yes. In UAE, actually, the teaching college is, as of now, RT is offered only in one college in Abu Dhabi, and they are looking for PhD candidates for associate professors, not with just masters. So you need a PhD right now. For me, the answer is that if you're looking the jobs abroad. But with a lot of colleges opened up in India, you need, if that's your role, maybe you should start working in a college and pursue your PhD. Or I don't know how are the next things. But for you, because you're specific to UAE, I can answer you one college and they need PhD. That's my answer.
So he also has the second part of the question, which is about how to do an RRT with an Indian MSc degree and its value in India as well as foreign countries. I think you have already answered the question. So Mohan, I hope you've got a good clear picture of how applicable the RRT degree would be. So the next question is from Ms. Deeksha, who's an intern, Yes, you have already answered the same question. Can I get a good job in Karnataka with a good salary? Yes. Uh, the next question is from Deepthi, who's also an intern, who asks what are the job opportunities? Yes, which you have already again covered in your presentation. Then, okay, another question is from Sahana, who's a first year UG, who asks about the job prospects abroad and what else is needed other than a bachelor's degree to work abroad.
You don't need anything. If you have a degree and experience, that's enough. Bachelor's, that will give you the jobs. And my suggestion to you all, keep a close relationship with your seniors, at least 2 years above you guys, so they you know where they are, how they got a job. If you have more good relation with like 3 years of your seniors, second year, third year, fourth year, being a first year, so you have, like, understanding of all those who passed out last year, where all they got placed, how is the market. There should be some, discussions among you guys. So there should be interaction with your seniors, keeping them in your close contacts, and they should help you out in getting the next term. And so if that's not being done, I suggest all of you to start doing it. Understand your seniors, develop the rapport, and be in touch with them. Keep asking your doubts. Along with what you're asking to your faculty, they also should be in your loop. That will help you all, because they are close. I'm talking about 9 to 10 years away since I left India. There are much different things that will come out from your seniors who just what all they gone through, what all struggles. They can tell you which is the right way in approaching, So maybe, you should have some sessions with them, talk to them who got a good hospitals, and aim it towards that direction. Start planning ahead. I started 6 months during my internship searching for jobs and start attending interviews. Then eventually I passed out in August and I joined in September, just 1 month. Yeah, I could place myself. Those days, there's no one knows about us out of Manipal. 2008, I think. Now I think many of them knows and they want us. So that's a different story now. But my suggestion: go out of your comfort zone, go to a state where it's there, North India, and handle the different culture. You get yourself strengthened by doing that. So you know how to get used to a new place out of your comfort, and maybe people will like you, and you will be unique. So give it a try. That's my suggestion. All of you
Right.
should get a good job.
So Nihal Shetty, who's an intern in Mangalore, asks what are the other fields. So he wants some clarity on what else other than a master's degree or clinical work can he pursue after his graduation.
I think, yes, we discussed that. There are different fields. So depending on your interests, hospitals, critical care units is the first one. Home care setups, rehabilitation centers, PFT labs, sleep labs. You can be into emergency rooms, developing the plans of how to receive these patients of post-trauma. Just a thought for you all. There are a lot of people who started this ambulance services and all with IT background, not with science background or with a general background, and all of us in RT having an ACLS, BLS certification should go into those companies. I heard a lot of companies have come up in Bangalore, Bombay, and all who are trying to serve this. We can be part of those teams, designing the model. So you need to save the earlier CPR trainings at a different level. So being part of those companies, you can also develop your own team. So you will be part of the ambulance also as a specialized trained person there. So that can be in a very different level. It's not just ambulances, airlifting these people. So this company, I heard there is a company in Bangalore who started airlifting. They need RT also. So if that is the thing, that's a challenge, and develop your trauma life support programs. There is trauma life support also. I think we are part of those certifications in masters. Are we still doing it, Bina? ITLS?
Yes, as a part of master's degree, we are bound to do that.
Yeah. So that
Yes.
you do that and you be part of that program. So these are all unique which are coming out, and a lot of things you guys can do. You should bring out those ideas, right? I'm saying people have oxygen concentrators or O2 saturations. Develop something you can loop it, an app, so that you can see in that area who all has it, what are they going through. A lot of things like you can develop. If you have masters, someone asked me, you can go into research in developing such things. And AI is coming into the picture, artificial intelligence. So are we looking into those as artists? What happens? You have a patient in ICU, you have 40 bedded ICU. So you have 10 patients for each RT. All 10 patients are linked to your mobile. The patient monitor, the patient ventilator, alarms, everything are linked to you, and you are asked to address the alarms immediately wherever you are away from the patient. If it is a potential risk alarm, you go to the patient fast. So in what time, who responded, you will get an alert back. This is again an AI feature. So you also should understand what AI is trying to bring into healthcare, have an understanding in that. Maybe if you like that, develop a knowledge, do some certifications. So there's a lot happening. It's all about us develop a baseline experience 2 3 years and then look at your interests and go into those fields. There's a lot of chance, so try to, all of us has to aim to support patients. I always think about what I can do at my town level where there is no real ICU beds. There are no specialists there. What can I bring into my town? So all of you start thinking from there. In next 5 years, you start supporting your own town people in quality health. That means you succeeded in your as an artist and in your life.
Right. So Ashlita Carol from third year undergraduate BSc is asking, uh, there are a couple of questions, but in the interest of time, I'm skipping through the first one because we have already seen it. The second part asks about something in the similar tune about the industry. What type of work can they expect in the industry? So I think we have already covered it, but if you can just brief on what are their roles, that would be fantastic.
Yeah, in industry, there's like two things. Actually, we are into application specialists everywhere. But if you have masters, maybe they should start considering you into research also. Start looking for such positions like into research in these companies so that you go into those once you finish your masters, do in the labs how this helps in developing a mode or a ventilator. But right now we have application specialists at very higher levels in Drager, Puritan Bennett and Mackey, and also basically you should have a business administration degree later on your career because you're trying to sell the product. Now you're able to develop the skills on explaining the product to larger people, make them buy your product among the competition. So you are the best because you know the ventilator well, you studied in depth about it. There are companies who are taking Aerogen, Aeroneb, and Fisher and Paykel for high flow. So these are the companies that want you, like research and the manager levels. Once you develop interest, you grow for 2 3 years in the company. They like you, they like the work you do. You become the manager for a South India or a region or a city, and then you develop plans how to grow your products, how to do things. So this is how it works, and then aim for growing to a very higher level in the company. From experience you get to know about it, but I think the MBA degrees help you later once you want to grow to next level in these companies. But point is, if you go in that direction, you may not think about bedside patient care. That's what you will miss, and so that's what you need to decide before you go. Is this right for me? And so that's fine.
So there are a few questions from Mr. Saket and Nandana about the duties and roles or responsibilities and about the salary. So I think, yeah, it's about the salary for the BSc and master's level. So I probably think he's weighing on whether he should stop his education after his bachelor's and pursue work, or whether he needs to go for a master's program, which is already clearly told or explained by Sir. So I think we'll move on to the next question, which is from Nanma Madhu, who's a first year UG student who asks about the scope and job opportunities, which we can probably skip. So the next question is about a very interesting one. So she asked, even after the pandemic, will we get sufficient job opportunities is one part. So I'll bring the next part after you answer this question.
Okay. Yeah, that was a great question, actually. And who was that?
Her name is Nanma from first year UG.
Okay, there are two things in this. Now, it depends on the situation. So definitely, we don't know. The pandemic is not over yet. There's new strains which are coming across, and it will be there for next 2 years, maybe at least. And then the new things are coming up. As I explained you a while ago, our role has increased actually. Our scope has increased. For us, the jobs will not wave off. And in India, now things have changed since pandemic. The second wave has thought a lot of new hospitals are coming up. As I said, the central government posts are going to open up for us. That's a new change. We never been into government hospitals. So all of you, I hope, will get a government job, which is a dream, right? For many of us, if we get a government job, what more we want? So in India, the prospects looks really great. And out of India, there are little changes to the hospitals. Because of the waves, some hospitals are converted into COVID hospitals, some are not COVID hospitals. And once the wave finishes, suddenly there won't be any patients. Again, the wave comes. So we are still not able to understand how to staff these kind of situations. But then over a period of time, our requirement has went up. We needed more of RTs. So the more beds are created, more hospitals are opened, more staffings are required, more specialists are required to take. So are we talking about how many of you and how many hospitals in India? All of you are observed very easily if you look at the numbers. The thing is, try a new hospital, try to meet a doctor directly in an ICU, explain what you know. Maybe they'll take you. A HR maybe doesn't know about you, but a doctor knows about you. So that's where I said the seniors will help you. You should be able to know who are the good doctors, who are the ICU, where they are working, try to meet them, try to go through a reference. So that if a HR doesn't want, a doctor will recommend and say, okay, I need this one in the ICU, then you will get into it. So this is the way to approach a job. Once, just not try once and say, oh no, I'm not getting. Keep, as a persisting person, try it. And if you like that particular facility, try all other options and get through it. So contacts will definitely help you guys and develop them, understand which doctor is where, if he's really, when you are attending conferences, and then take it from there. So I hope I answered what is the first part.
Yes, sir. So the next part is about how much do the PG courses benefit their career?
As of now, I think, as I explained earlier, if you feel you're an academic person who likes to learn, update yourself more, and teach, if teaching is what your passion is, that is where the master's role comes in. As of now, outside in India or in clinical job, when you go there, they don't see a bachelor's, master's differently. We are still not at that level, even out of India also. Now they are doing masters in US and PhDs, and that's a different thing. So there is a research educator positions that are being developed in the hospitals. And then, so there is a different, so must be, those positions will be open only to master's candidates, but it's at beginning level right now. So first our staffing numbers should increase, then the hospital should have one educator to keep training new things to this clinical staff. That's a very high level thing. And if a hospital is ready to do that structure all over India, then you will get a educator position as a master's. in all the hospitals. But otherwise, till now, there is no variation. But then for you, you should look for teaching jobs in and out of India with your masters and try to pursue your PhDs. That will be your path if you take masters, and then look for research opportunities in any of these companies. Try to start applying, talking to them, and then show that you have knowledge and skills to be in those. That's my suggestion. Not think only about clinical level, that what is the difference between me and a bachelor's. Don't bring that right now into this. If you did masters, you're in a different stream. If you did bachelor's, you're in a different. That is how it is. That is how it is looked right now. It may change in next 5 years, I suppose.
Right. So the next question is from somebody who is in the third year who does not wish to be named. So you have already answered a question about that. It's about TMC, the therapist multiple choice. So since we have already gone through that, discussed it in great detail, we'll move on to the next question, which is from an intern from Mangalore, Nima Maria Varghese, who asks, can we do MSc in any other subject after finishing BSc Respiratory Therapy? For example, she cites the example of MSc Embryology after this. So Nima, I would, yes, sir, I'll let you answer it. Yes.
Yeah, but no, I cannot. I don't know the requirements of admission criteria.
Yes, sir. So I was about to say that it depends on the entry requirement for the set course. So if you are planning to do an MSc in embryology or clinical embryology, you would probably like to search for what are the requirements for that particular course. So it depends all on that. So I guess that is. Any medical background degree would be a valid starting point for clinical embryology, but you should always go and look back.
They will ask for basic laboratory thing. I'm not sure, but see, there is no end for changing the branch for you all. That's what I want to say. If you think that's your interest. But then again, you need to search for the admission requirements for that particular course in various colleges in India, out of India. Some of them may accept you, some may not. So it's up to you. But then don't limit yourself. If it is, search for more into it and then go for an option that allows you to go and if that's your interest. Yeah.
Especially since most colleges, the requirements, the entry requirements might vary from college to college. So it would be a good choice if you can search for the requirement in all the reputed institutions so that you consider all your options before committing to any of those. So the next part of Nima's question is if BSc degree is enough for a respiratory therapist? Yes, I think the answer is very clear by now, clear as day.
I have only bachelor's, so you all. So that's my profession, and I cleared RRT. So I'm sure all of you can clear RRTs if you are eligible. That's a different story. Let's not go there. So you don't need that. Yes, you get a job with bachelor's with experience. So try to develop your skills and keep updating yourself. Read journals and participate in research. If you're working in a hospital, that makes the physician know, okay, these guys are doing something. So if you don't do all this, they think that you're a routine regular person. But when you go and say, I have an interest, because Manipal is an excellent university which gives you the things of everything. So you have research that's happening in the department. Try to publish something when you are in the university so you know what it is, how it is done. So when you go out of it, take the help of the faculty at Manipal. They can help you join them into your study and publish it in the journal, national and international journals, and you get a hang of it. Then people will start. Then you strengthen your CV by doing such things. Then you start learning a lot when you try doing all this. But if you don't do such thing, your CV won't be look unique. So that's your aim. Every 2 years checkpoint, make your CV unique. Work in a hospital which is busy and gain as much confidence as you spend more time at bedside. Definitely all of you will get bright jobs and good salaries. There will be a change. I can see that happening and I'm positive towards that.
Right, sir. So coming to the last question that we have managed to collect is from Ms. Anju, who asks, can you explain the role of respiratory therapist in pulmonary rehabilitation setup?
Yes, Anju. Yeah. See, right now, a COVID person. Let's take a COVID as an example. What you will do now? COVID person comes to a hospital, spend almost 2 to 3 weeks. That's the average time if they are in an ICU to get out of the ICU. So, what happened in that 3 weeks? We have paralyzed them, give high sedations. So, to say simply, when you put a patient on ventilator, sedate them and all, your main muscle is respiratory muscle is diaphragm that goes into not working anymore. It takes rest and it sleeps. So you need to start doing inspiratory muscle trainings. They need to have good nutrition, develop the strength in their muscles. So follow up. When we extubated these patients, we couldn't keep them in the hospitals due to the surge. So they were all sent when they are on low ventilatory support or extubated immediately to rehab centers. In the rehab centers, you RT has worked closely with a physical therapist and occupational therapist and a speech therapist if they have tracheostomy in closing the tracheostomy, strengthening them, doing exercises, making them back. They should go back to the normal work, and it takes long time. And they will be requiring some amount of oxygen because whoever had COVID is not, once you extubated, feeling tired, not able to do the work properly. So during this in the rehab centers, you develop a proper plan for this patient to target them to go back to their normal life, how they were before COVID till they are feeling confident about themselves and doing this, you will be supporting them in the various levels. PT will support with this PT exercises, nutrition will support with nutrition. You will do the oxygen requirements, meaning, and you will see whether he really needs an oxygen, he doesn't need an oxygen, and how much is really required. Too much of oxygen is not good, too low is also not good. So all these, now this is the role which comes in. Different patients will come in. Some are on ventilator, some are on an IV, some are on simple oxygen. So you will have a different plan for different patients. Aim is to send them home with a minimum oxygen, and they should do their work. This is what you do.
All right. Saket, would you like to ask something to our expert? All right. So that was the last question that you just answered, sir. So I thank Sir, Mr. Harsha sir, for taking a great deal of his time and being with us and clarifying all his doubts. So to the audience, I would like to request you to kindly give a feedback for the session. The link for the feedback has been posted in the chat box. I request you to kindly take a couple of minutes out of your time to fill the feedback. That would really help us improve and bring more quality contents to you. So now I would like to request Ms. Ranjita, a faculty from Mangalore, to propose the vote of thanks.
Good evening, everyone. I, Ranjita, from Department of Respiratory Therapy, Mangalore campus, would like to propose the vote of thanks on this occasion. First and foremost, I would like to thank our resource person for today's session, Mr. Sriharsha Tatineni, who is a proud alumnus of Manipal and never misses a chance to give back to his alma mater. The moment we made a request to help the budding artists through an online session on career paths, he readily agreed wholeheartedly. Thank you, sir, for answering all our queries and guiding us and pointing us in the right path. I shower my heartfelt thanks and gratitude to Dr. G. Arun Maya, Dean, Dr. Sabu K.M., Associate Dean, and Dr. Krishna Y., Associate Dean of Manipal College of Health Professions, Manipal, for the constant support and encouragement. My sincere thanks to Ms. Indu Toby, Chairperson, Student Affairs Committee, Manipal College of Health Professions, for lending her hand in organizing any event in Manipal College of Health Professions, Manipal. I extend my heartfelt thanks to Mrs. Pratibha Todur, in charge and head, Department of Respiratory Therapy, Manipal College of Health Professions, and Mr. Binoy K. Kuriakos, Assistant Professor, Department of Respiratory Therapy, and our organizing secretary for organizing such a wonderful session for the RT students of Manipal and Mangalore. I would also like to thank Dr. Shaila S. Kamath, Professor and Head, Department of Anesthesiology, KMC Mangalore. I thank all the faculty members of Department of Respiratory Therapy, Manipal and Mangalore for in helping with the smooth conduct of the Respiratory Care Week celebration 2021. Last but not the least, I thank all the students for participating in today's session and also in the competitions organized on the account of Respiratory Care Week 2021 and Azadi Ka Amrut Mahotsav and making the celebration of Respiratory Care Week 2021 a grand success. Thank you, one and all. Wish you all a good and happy Respiratory Care Week.
Thank you, Ranjita.
Thank you, Ranjita, for such words. It was great meeting all. How many we had? 75 plus?
Yes, sir. At some point, more than 75 years.
Interacting. I'm looking forward for more such sessions whenever you can do it. We'll see the feedback, take it from there. I'm sure. And all the best to all of them. And yeah, happy Respiratory Care Week.
Happy Respiratory Care Week.